sonographic evaluation of uterine masses. If we look at the visualization of uterine blood vessels, the main important things which we have to notice are the arcuate artery, then we have the basal and radial and spiral arteries. The spiral arteries are entering into the endometrium and they are the main blood supply of endometrium. On color Doppler, you can see a necklace-like appearance. This is the arcuate artery, which is at the border, at the periphery of the body of uterus. Then we perform spectral Doppler studies, and the spectral Doppler we get the spectrum, and this is a spectrum at the reproductive age. There is continuous, this is upside down, this is systolic and diastolic. So it is forward diastolic. This is the baseline. So anything below the baseline will be abnormal. And here you can see this is forward. If it is below the baseline, it will be backward flow. So forward systolic and diastolic flow. The uterine artery resistive index assessment is very important for especially for infertile patients and postmenopausal patients to rule out the cause of infertility and to assess any pathology which is related with the postmenopausal status. Here is again the uterine artery, which is postmenopausal. Look at this, the diastolic has decreased as compared to the systolic. This is systolic, diastolic, whereas this is the mirror image of spectrum. Postmenopausal patient, in here we can see the diastolic is absent and systolic is also a bit smaller as compared to the normal. So absent diastolic flow. This is reversal of the diastolic flow. So first we had a normal diastolic flow, which is about 1/3 to 1/4 of the systolic flow, which is diastolic is decreased, then it is absent, then it is reversed. These are 4 types of diastolic flows which we can get in the uterine artery. Then is the spiral artery. This is a triple line endometrium and spiral arteries perfusion on color Doppler. Here is the spectrum which we get this systolic and diastolic. This is mirror image of it. And here is the spiral artery. This is secretory endometrium, and here it is the borderline. For visualization, rates of the uterine are radial and spiral arteries in postmenopausal patient. This data is very important. At age of 20 years, 1 to 5 years, 100%, we can see the uterine artery, radial artery, and 30% of the spiral arteries. Whereas in the age of 6 to 10 years, this is the number of patients which were total were 85 in that study, which was done by Professor Kurjik and Tupeskic S for fertilized sterile 1995. This was published. 19 patients from age duration of the menopause. So from menopause 6 to 10 years, this is the first 5 years from menopause. So first is the year when the menopause started. This is 6th to 10th year, 100% uterine and radial, but difficult to get the spiral. Similarly, in other ages which are above 5 years, it will be difficult to visualize the spiral artery in postmenopausal because the endometrium is not that much functional. We are not getting much flow on it. and it is not needed because the endometrial cycle has stopped. That's why we call it postmenopause.